Hello. Today I'll be talking a little about the Affordable Care Act, also known as Obamacare. Why is it important to understand the healthcare system as a community psychologist? Healthcare is an essential and basic need of all people. Assuring positive health outcomes for all people, especially minority groups, goes hand in hand with the goals of community psychology. Since the creation of managed health organization, healthcare has shifted towards prevention, which helps people promote patients' empowerment by giving them more control over their health. Healthcare costs and accessibility intersect with promotion of social justice, equality, and other tenets of community psychology on various ecological scales. The current healthcare system. Lack of transparency. No one knows the price of most services in healthcare. Usually you find out after you get the bill. High cost of care. In 1970, we spent 74.1 billion. In 2000, we spent 1.4 trillion. And in 2019, we spent 3.4 trillion. That's more than a 4,000% increase. Not enough people have insurance. Outside of Medicaid and Medicare, a large number of Americans do not have proper coverage or any at all. Shortage and inefficiency. The healthcare system is riddled with wasteful spending and lack of care, which has led to a drop in quality. The data. As you can see, the chart on the left shows how much the cost of healthcare has risen in comparison to all other goods and services. The chart on the right shows the number of uninsured Americans between 2010 and 2020. Obamacare helped lower the number. Whoa! With so many issues, we can see why such a drastic and unprecedented course of action like the ACA was passed. But did the ACA make things better or worse? What got better? More Americans were able to obtain insurance due to Obamacare. Some people now have a wider range of coverage while being affordable. People with pre-existing conditions were no longer denied coverage. Insurance companies could no longer set a dollar limit on coverage. More focus and coverage for preventative care, which helps decrease spending in the long run, since issues are treated before they get worse and more costly. More coverage and lower costs for prescription drugs. Expansion of Medicaid programs to help poor families and disabled individuals. What got worse? Higher premiums on healthcare insurance for most people. Individual mandates still pose an issue of its own. With less people enrolled, prices for insurance has gone up. Higher taxes and more government spending. Company cut hours to avoid having to provide healthcare. Many people lost coverage due to required coverage for service not required. For example, some policies were canceled for not providing maternity care even if the policy was written for a male. Increased wait times and lower quality of care. Higher taxes and costs for high-risk plans, like plans for people with dangerous jobs like construction and steel workers. So what should we do? There is no such thing as a perfect system or perfect solution. Keeping Obamacare as it is will further cause healthcare prices to increase while failing to address some of the issues that were there in the first place. Outright repealing Obamacare will strip millions of Americans out of newfound benefits and healthcare they now rely on and would have otherwise not had without the ACA. Like in many problems, we need to keep what's working and work on fixing or getting rid of what isn't working. We need to keep Obamacare, but reform it to be better and work for more Americans while being sustainable and effective. A compromise. Premium tax credits should be implemented to make it more affordable for middle-income Americans who do not have employer-sponsored health coverage and do not qualify for subsidized plans. Price transparency should be mandatory, especially for elective service. There is no other system where you get billed after service without seeing prices beforehand. Eliminate segmented local and state healthcare markets and create a new competition within healthcare in terms of pricing and quality. Empower the consumer so that insurance companies and health providers must compete with their business. If there is a need to complete healthcare, will follow a majority of the other services and goods where companies compete to offer the highest quality at the lowest price to gain as many customers as possible. If people can shop for cars, TVs, groceries, plastic surgery, why shouldn't they be able to shop around for necessary health services? Allow for easier innovation and roll out new equipment and medication to the market. In conclusion, the number of issues and how to solve them can be debated for eternity. These proposed solutions, though not perfect or exhaustive, can definitely help with some of the main issues facing the healthcare system and the people who use it. As community psychologists tackling the problems of American healthcare, we need to make sure to incorporate the principles of community psychology in order to make proper changes and progress. There is a place for community psychology at the forefront of this issue. Using the ecological theory and focusing on the principles of community psychology, along with data and research-driven methods, there can be a successful intervention via legislation in the American health system. Thank you.